Welcome to REM Award, the podcast that explores the secrets of sleep and psychology. I'm your host, Ryan, and in each episode, we'll dive deep into the world of sleep and other topics such as mental well-being and personal growth. If you want to unlock your full potential and receive the rewards that come with understanding the power of sleep, you're in the right place. To discover more tips and insights on improving your sleep and overall well-being, visit our website and explore our other episodes at remaward.org. We are thrilled to welcome two distinguished guests to today's discussion, Dr. Anita Shelgikar and Melissa Clark, both of whom play key roles in shaping the field of sleep medicine through their work with the American Academy of Sleep Medicine and its foundation. Dr. Shelgikar is a clinical professor of neurology at the University of Michigan Medical School and an expert in sleep medicine education, research, and clinical care. She has been a member of the AASM Foundation Board of Directors since 2018, serving as president from 2020 to 2023, and currently holds the position of immediate past president and secretary/treasurer. With her extensive experience in sleep research and funding, Dr. Shelgikar is the perfect person to provide insights into AASM's groundbreaking research initiatives and how they are shaping the future of sleep medicine. Also, Melissa Clark is the Director of Advocacy and Public Awareness at the AASM, where she leads efforts to promote sleep health, influence public policy, and support the growth of sleep medicine. With her deep knowledge of AASM's history and evolving role in the field, Melissa will guide us through the Academy's origins and its most impactful milestones and its ongoing efforts to advance sleep care on a national and global scale. Today and together, we'll explore the history, research advancements, and future goals of the AASM, diving into the ways this organization has shaped the field of sleep medicine from advocacy to funding cutting-edge research. This is a really interesting podcast episode starring two podcast guests, so stay tuned for an insightful conversation. So, what were the key factors that led to the creation of the American Academy of Sleep Medicine in 1975?
So the American Academy of Sleep Medicine, or ASM, was first known as the Association of Sleep Disorders Centers. So that's kind of why it was established first, as kind of a science and practice of sleep medicine in the sleep center initially. So the practice of sleep medicine was just beginning to gain greater acceptance in the medical community. Prior to that, prior to 1975, it had been more of seen as more of like an experimental kind of thing, even though the first sleep center had actually been established like 10 years prior at Stanford. But by 1975, there were several other sleep centers that had been established at that point at other hospitals and universities. And that year is actually when reimbursement for sleep medicine services really started to be accepted. So leaders that were in the field at the time kind of met and discussed and decided that an organization was needed to support those sleep centers and the sleep clinicians that were working at them to try to get more mainstream medical acceptance of sleep in clinical practice and research.
Right, that's super interesting. Thank you for that. And I guess you probably touched upon this a little bit, but what were some of the initial challenges faced by AASM, and how are they overcome to establish the organization as a leader in sleep medicine?
Yeah, so, I think that a lot of the challenges that they faced are probably challenges that are kind of inherent when trying to establish a new field. They're trying to establish new standards for the diagnosis and treatment of sleep disorders. They're trying to establish sleep medicine as like a specialty within the greater medical field. And when doing those things, you know, there's a lot of work that has to go into establishing those standards and, creating credentialing requirements while at the same time trying to advocate for the acceptance of sleep, not just like in the medical field, but with, professional health organizations, with the government, regulatory bodies, with health insurers. So there's just a lot of different things that were going on at the same time and trying to create kind of this new specialty while at the same time trying to gain acceptance. And so I think that, you know, it just takes a lot of time to do all of that. And I would imagine that those are kind of challenges that any new specialty would face when trying to start.
Right, yeah, that makes a lot of sense. And how has the role of AASM evolved since its inception, particularly in terms of its impact on sleep medicine practice and research?
Yeah, so initially the ASM, like I said, was kind of created to establish and maintain standards, provide a forum for the exchange of information on sleep, and promote sleep in clinical medicine. And, those activities led to the establishment of initial standards for care and sleep and led to the basis of the specialty. But since then, the scope of sleep medicine has gotten so much wider that, the role of the ASM has also had to evolve at the same time. So, we still do all of those fundamental things that we initially like undertook when the organization was getting going. Setting clinical practice guidelines and accreditation standards and doing advocacy. But at the same time, we've evolved to help advance sleep care and improve sleep health for everyone through a lot of other things that we've taken on beyond what we kind of initially were doing. We do a lot of education. We have an annual meeting with the SRS called the APSS Sleep Meeting, which 5,000 people attend. It's a huge educational meeting. We, um, set evolving accreditation standards. We advocate with insurance payers and legislative bodies. We have the Journal of Clinical Sleep Medicine, where we publish sleep research on a continuous basis, and also just helping our members to navigate the new frontiers in sleep and disruptions to sleep and medicine. Things like, COVID, or we recently had a PAP device recall that affected a lot of members and patients. So just helping members to navigate those kinds of um, issues which goes kind of beyond what was initially envisioned, I think, 50 years ago when the organization was established.
Right, that's amazing. And I think you touched upon this again a little bit, but how has like the membership base of the ASM changed over the years, and what does this growth indicate about the state of the field?
Yeah, I mean, like I said, I think that, the membership has definitely grown, in those initial years in 1975, it was really just those initial sleep centers and the clinicians that were working at them. It was a really small, like tight group of people, and now we have over 11,000 members, including both sleep clinicians and the sleep team and sleep centers across the United States. So the field has definitely grown a lot, over the last 50 years. And although our core membership is sleep specialists, with the evolving field, we have kind of changed membership and added new categories of membership to account for new people who have entered the field. So we have like a sleep team member who could be a sleep technologist who works in a sleep center, or an advanced practice provider, nurses, respiratory therapists. We also have student and resident members, which actually that's free right now. We to try to get allow students and residents to learn more about the ASM and sleep medicine as they're entering um, the field, and deciding if they would like to do a sleep fellowship, that kind of thing. And we also have international members. So it's definitely, a kind of a core membership of sleep specialists, but also making sure that we are, working for everyone who's working in the sleep field at the same time.
Right, that's intriguing. Thank you for that. And then I think switching gears here to more of a research base, what are some of those groundbreaking research projects currently supported or sponsored by the ASM?
Yeah, thanks so much for that question. The AASM has a philanthropic arm, the AASM Foundation, and it's through the foundation that research is supported and funded. And under the domain of the AASM Foundation, there's support for research programs, community programs, and training programs. So I think all of these are very near and dear to our heart, and hard to identify just one groundbreaking research project. But when we think about, again, categories of research supported, it really spans everything from people coming into the field and also the patients we serve.
Wow, it's amazing. I'm super happy to hear about that. And then how does the ASM decide which research areas to focus on or fund, and how does it address emerging trends in sleep medicine research?
Yeah, it's a great question. So the AASM and the AASM Foundation are very tightly aligned, and in identifying these specific priorities, both organizations will seek input from subject matter experts, from patients and patient advocacy groups, from clinicians, and from researchers, and take all of that input into account to identify emerging trends and pressing needs, and ultimately to determine the funding priorities year over year. So that's always looked at to make sure that it's current and what's most beneficial to the field.
Right. That makes a lot of sense. And can you discuss, like, I guess, any recent findings or studies that have been particularly influential in shaping, I guess, current practices or guidelines in sleep medicine?
Yeah, absolutely. So when we look at the research that's been funded by the AASM Foundation, there's actually a large body of literature that has been published that then feeds forward to inform clinical practice guidelines, informed evidence-based care. I would love to direct you and your listeners to the AASM Foundation website. There's a long list of actually project results, and many of which have been published in the Journal of Clinical Sleep Medicine. But just to give you a brief overview, they cover topics such as aging, artificial intelligence, circadian rhythm, sleep-wake disorders, community projects, education, high-risk sleep populations, hypersomnolence or excessive sleepiness, insomnia, narcolepsy, and obstructive sleep apnea. So again, I think that reflects the diversity of the projects that are supported by the AASM and the AASM Foundation.
Yeah, I completely agree. I'll make sure to link that down below. Yeah.
Great.
Um, and how does the ASM like foster collaboration between like researchers, clinicians, and then other stakeholders to advance sleep science?
Thanks for that. The ASM fosters collaborations in a number of ways. So having diverse volunteers who represent the ASM and work on ASM committees and task forces, inviting experts to speak at conferences, collaborating with stakeholders on roundtables, participating in multidisciplinary scientific and advocacy endeavors, oftentimes in partnership with patient advocacy organizations or other scientific organizations, and supporting training programs for researchers who are in training and early in their careers to be able to support their growth as researchers and ultimately help the patients that we serve.
Wow, that's amazing. Yeah. And then I guess like what role does the ASM play in like translating like research findings into like practical applications for improving patient care and sleep health?
Yeah, absolutely. That's a critical portion of the scientific process. So the ASM publishes clinical practice guidelines that guide implementation of evidence-based practice for the diagnosis and treatment of sleep disorders for patients of all ages. The ASM also advocates for adoption of patient-centered policies at both state and federal levels, again, in partnership with other organizations who have similar priorities. And the ASM and ASM Foundation collaborate with patient advocacy organizations and again, other partners, other scientific organizations, for example, to help disseminate our evidence-based guidelines to ultimately improve patient care and sleep health.
Right. Makes a lot of sense. Thank you so much for that. Yeah. And then I
Welcome.
guess switching gears again to like more of a goals and initiatives of ASM, my question is going to be how does like the ASM prioritize its goals in advancing sleep care and what metrics are used to measure like success in these specific areas?
So the ASM publishes a strategic plan every 3 years to prioritize our goals. Currently, we actually just published a new strategic plan in May of this year. So currently, we have three main goals: sleep medicine awareness. So basically, engaging in advocacy to promote the value of sleep medicine, practice success, ensuring that sleep practices in diverse settings can deliver quality care and innovate to achieve better patient outcomes, and technology integration. So guiding the sleep team professionals in integrating new and emerging technologies in clinical care. So right now, those are kind of our three big goal areas. And we set operational goals for specific tasks and projects and measures that we want to hit depending upon the initiative that we're addressing. So the metrics for each of those would vary depending on the area and what kinds of things we're doing to kind of undertaking to address whatever the goal is. But they could include, things like having a certain amount of educational opportunities on a certain subject, or engaging our members in certain ways over the year, or like for instance, in awareness campaigns, a certain number of people that we would like the messaging to get out to. So
Right.
really just kind of setting like a measure depending upon what the initiative is.
Right, yeah. And expanding on that, can you discuss, I guess like recent or upcoming initiatives by the ASM aimed at improving like sleep health and care on a national or global scale?
Sure. So, right now we have a national awareness campaign that we're running called Sleep is Good Medicine. So, again, it's a national campaign that's kind of out to just um, have people understand the importance of healthy sleep generally, and giving them the information and resources that they can use to kind of learn more about sleep and what healthy sleep looks like, how to integrate healthy sleep habits into their lives to make sure that they're getting the sleep that they need. I think that a lot of people don't understand, or maybe don't internalize the importance of sleep, in conjunction with things like diet and exercise, that kind of thing. So we do try to look at kind of the general awareness of sleep across the country initially. And then, so that's just one initiative. I do think, we also have different task forces and committees who look at specific issues that are affecting the field. So things like AI or workforce issues, things that are affecting the field, but in turn affect patients and the public. So, if we have workforce issues within the field, then obviously that's going to affect um, the availability of care for patients who need that care. So, trying to address those issues as they come about for the field to make sure that our members can be providing the highest quality of care to patients across the country.
Right. Super happy to hear about that. Yeah. And I think it was touched upon before, but I guess if you can maybe expand or like recap, like what strategies does the ASM employ to ensure its initiatives align with the evolving needs of sleep medicine professionals and patients alike?
Sure. So, yeah, we have a couple of different mechanisms in place that allow us to do that. I think one is member surveying. We frequently ask our members what's important to them, to try to get an understanding and a baseline of what issues are affecting them in their practice, and what the ASM can do as an organization to address those issues. So whether it be like advocacy priorities, or, other issues that are affecting their practice, trying to determine what those issues are, and then helping them to address it. And then we also have, our committee structure. We have a lot of great committees who really tackle every issue that's affecting our members and affecting the field. So we have awesome volunteers from the membership who serve on all of these committees that meet monthly, and they talk about these issues. So they're bringing their personal experience into those conversations, and are allowing us to address whatever topic the committee is looking at effectively, because we get the different perspectives from, 10 or 12 different experts in the field on each of those issues. So, I think those are probably, at least in terms of learning from our members what's going on in the field, those are a few great mechanisms. And then we also have commissioned studies in the past to kind of get more of an overview of the landscape of the field. And we also work with patient advocacy organizations to get kind of more of the patient and public perspective as well. So we actually have a patient advocacy roundtable that a lot of the patient advocacy organizations that serve patients that have sleep disorders participate in that, and provide us with their feedback to make sure that, again, we're incorporating the patient voice in what we do.
Right. Yeah. Thank you for that. And in what ways does the ASM engage with, I guess, like policymakers to influence health policies related to sleep medicine, circadian health?
Yeah, so we do a lot of great advocacy work. So we do um, engage with like regulatory bodies on like payer issues, making sure that insurance companies are paying for sleep services that patients can get there. Um, like diagnostic procedures and treatment covered, that kind of thing. We also work with on both the state and federal levels in terms of like the legislature. So we do letter writing. We have member campaigns online that we ask members to send messages to their policymakers. We do virtual and in-person meetings with state and federal legislators. We actually just had our largest Hill Day ever this year. So we had over 30 members go to Washington, D.C. in the spring, and we had over 40 meetings in one day with different congressional offices on issues that are important to us. So we talk about things like daylight saving time and payment for sleep services and telemedicine and a lot of other issues that are important to the ASM and our members. And then we also have members serve as expert witnesses or provide testimony on issues, which has been really effective, specifically at the state level. So, for instance, recently there was a law passed actually just this year, a few months ago in Tennessee that would allow our A-STEP program, which is a educational program for sleep technologists, to be used as an educational pathway for sleep technologists in Tennessee. And so we had a member who lives in Tennessee and practices in Tennessee, went to the hearing for the bill to advocate for its passage, and then it passed. So, I mean, I think that that's, a great example of how our advocacy is really making a difference for our members and in the field.
Yeah, I completely agree. That's amazing. Wow. And then for my last question, could you just elaborate on any, I guess, collaborative efforts on the ASM is involved with other organizations or institutions? So I guess like further the field of sleep medicine.
Sure. So yeah, we definitely, we frequently collaborate with other organizations, professional organizations that have members in the sleep field as well. We collaborate on education or on issues that kind of come up as needed. Like I mentioned, there was a recent recall, and we had some educational things that we had done with some of the other professional organizations in the field. So, that's a frequent thing that we do. We just actually wrapped up a major awareness campaign that was a great collaborative project. So we had a grant from the CDC for um, awareness of obstructive sleep apnea called Count on Sleep, and we worked with 8 other organizations on a 3-year long project, both professional organizations as well as patient organizations, and we worked with community stakeholders on that as well. So we actually worked with different organizations that work out actually with patients in specific communities to help us, distribute information and make sure that materials were representative of the populations that we were looking to address. So we really do try to work with whether it's professional organizations, patient organizations, community stakeholders, kind of bringing in all of the different stakeholders that would be important to have on whatever kind of project we're doing to make sure that we are, representing the field and, having as many unique viewpoints as possible to address issues that are affecting both patients and the public and our members in the sleep field.
Yeah, that's really great to hear. Well, I think those are all the questions I have for today. I appreciate both of you for coming on and taking the time to talk on here. I'll make sure to link everything down below, and I'm sure that our viewers are just as grateful as I am to have you both on. So thank you again.
Thank you, Ryan.
Thank you.
Thank you for tuning into the Reward Podcast. Before you go, we'd appreciate your support by subscribing, liking, and leaving your thoughts in the comments. Stay tuned for our next podcast, where we will be joined by a special guest speaker to explore even more about the fascinating world of sleep and psychology.